Lomotil is a medication used to treat diarrhea by decreasing the number and frequency of bowel movements. It works by slowing the movement of the intestines. This medication contains diphenoxylate, which is similar to opioid pain relievers, and atropine, which belongs to a class of drugs known as anticholinergics. These components help to dry up body fluids and slow gut movement. It's important to note that Lomotil should not be used to treat diarrhea caused by certain types of infection, such as difficile-associated diarrhea following antibiotic therapy. This medication is not recommended for use in children younger than 6 years due to an increased risk of serious side effects, such as breathing problems. The daily dosage and optimal timing for taking Lomotil should be determined by your doctor based on your specific condition. Be sure to talk to your healthcare provider for more details on how to use this medication. The recommended dosage for Lomotil is usually 4 times a day, as directed by your doctor. The amount of medication you should take depends on your medical condition and how you respond to treatment. For children, the dosage is also based on their weight. If your diarrhea is under control and you need to continue treatment, your doctor may instruct you to lower your dosage. It's important not to increase your dose, take it more frequently, or use it for longer than prescribed. If you are using the liquid form of Lomotil, be sure to measure the dose carefully using a special measuring device or spoon. Do not use a household spoon, as you may not get the correct dose. To prevent dehydration, it's important to drink the right amount of fluids and electrolytes. If you experience signs of dehydration, such as extreme thirst, decreased urination, muscle cramps, weakness, or fainting, contact your doctor immediately. You may also need to switch to a bland diet during this time to reduce irritation to your stomach and intestines. If you have any questions, consult your doctor or pharmacist for more information. If you suddenly stop using Lomotil, you may experience withdrawal symptoms, such as stomach cramps, nausea, and vomiting. To help prevent withdrawal, your doctor may gradually lower your dose. Withdrawal is more likely if you have been using this medication for a long time or in high doses. Contact your doctor or pharmacist right away if you experience withdrawal symptoms. If your condition does not improve after 2 days of using Lomotil, inform your doctor. Some common side effects of Lomotil may include drowsiness, dizziness, headache, tiredness, blurred vision, dry mouth, and loss of appetite. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any serious side effects, such as stomach or abdominal pain, severe nausea, vomiting, mental or mood changes, or numbness and tingling in your arms or legs. In rare cases, a very serious allergic reaction to Lomotil may occur. Seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling of the face, tongue, or throat, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist for further guidance. As always, if you have any concerns about the side effects or usage of Lomotil, do not hesitate to reach out to your healthcare provider for assistance with your specific situation. Before taking Lomotil, talk to your doctor or pharmacist if you are allergic to either drug, hyoscyamine, or if you have any other allergies. This medication may contain inactive ingredients, which can cause allergic reactions or other problems. Before using Lomotil, tell your doctor or pharmacist your medical history, especially if you have liver disease, dehydration, mineral imbalance, a certain type of bowel disease, or personal or family history of glaucoma. Lomotil may make you dizzy or drowsy. Alcohol or marijuana can make you more dizzy or drowsy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. Avoid alcoholic beverages. If you are using marijuana, talk to your doctor. Liquid forms of Lomotil may contain alcohol. If you have alcohol dependence or liver disease, use this product with caution. Ask your doctor or pharmacist about using Lomotil safely. Before having surgery, tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Children, particularly those with Down syndrome, may be more sensitive to the side effects of Lomotil. Very serious effects may occur if too much of this medication is taken by children. During pregnancy, Lomotil should be used only when clearly needed. Discuss the risks and benefits with your doctor. This medication also passes into breast milk, so consult your doctor before breastfeeding. When taking Lomotil, it's important to be aware of potential interactions with other medications. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with Lomotil include pramlintide, MAO inhibitors, naltrexone, and potassium tablets/capsules. Additionally, it's important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Always check the labels on all your medicines, as they may contain ingredients that cause drowsiness, and ask your pharmacist about using those products safely. Remember, do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much Lomotil and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe drowsiness, muscle weakness, fast heartbeat, high fever, unusually fast/slow/irregular breathing, seizures, and loss of consciousness. Sharing Lomotil with others is against the law. Always use this medication only as prescribed by your doctor. If you forget to take a dose of Lomotil, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. Make sure to store Lomotil at room temperature, away from light and moisture, and do not freeze the liquid. Keep it out of reach of children and pets. Do not flush Lomotil down the toilet or pour it into a drain. When it is expired or no longer needed, consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.